Hello everyone, our presentation for today is Cytological Artifacts, Contaminating and Mimicking Masquerading Interpretation. Without further ado, let's go. The first artifact that may appear in cytological smears is cornflaking artifacts, where it is a common phenomenon, especially in pap smears. It is also an air bubble artifact that is brown and conceals the nuclei of superficial cells. It has a brownish crinkly appearance and mostly appears on superficial squamous cells. The effect of this artifact is if it is present in large scale, it can cause slides not suitable for evaluation by cytoscreener, and inexperienced cytoscreener might have a hard time to evaluate the cells, as the cornflaking artifact may distort the cell morphology. The causes of this artifact is when there might be delay between removing the slides from the last xylene during staining or poor dehydration during xylene immersion. Sometimes it might just take place just before the cover slipping, as the mounted medium begins to evaporate. This artifact may also due to air trapped within the surface grooves of mature squamous cells or cover slipping multiple slides at a time. So how to prevent or minimize this artifact? First, cover slip one slide at a time. Next, return the slides through xylene and alcohol, then restain and recover slipping. You should also avoid delaying the process of cover slipping after taking out the slides from xylene to avoid any evaporation. We can also improve the smear appearance by remounting the slide. As for worm-like artifacts, the presence of worms in cytological smears is sometimes being reported, although various other structures exist that may be confused with parasites. As for human hair, especially in pubic hair, it can mimic parasite microfilariae. As you can see on this slide, there is slight differences between these two, such as in human hair, we can see the medulla, cortex, and cuticle of the hair, while for the microfilariae, we can see a lot of nuclei in the body of the parasite. On the other hand, what makes them look similar is as both have a long, uncoiled body. This can lead to misinterpretation, flawed diagnosis, and false positive or negative results. We can prevent this by making sure that the lab staff wear a hairnet to prevent hair falling to the sample. It also requires a very careful technique while swabbing the cervical area and not to swab the perineum area. Last but not least, always refer to the guideline, patient history, when in doubt.
Next, I will explain about iatrogenic contaminants. What is iatrogenic? It is a substance or agent that unintentionally contaminates medical procedures and can potentially cause harm or adverse effects to patients. In the case of pap smears, iatrogenic contaminants can include substances like lubricants, ultrasound gel, or synthetic fibers from cytobrushes. During a pap smear, lubricants are sometimes used on the speculum to reduce discomfort for the patient. However, if these lubricants come into contact with the collected pap sample, they can contaminate the specimen. This contamination may manifest as the presence of amorphous granular deposits. One example of a lubricant commonly used is aquagel, which can present as a pale, lacy, and homogeneous material. Lubricants can sometimes mimic clue cells. Aquagel material can stick to the edges of squamous cells and also can appear as a pink to purple stringy background or granular bacteria-like material. On the other hand, clue cells are seen as squamous epithelial cells with a large number of coccobacilli organisms, densely attached in clusters to their surfaces, giving them a granular appearance. So how to prevent lubricants from contaminating smear? First, instead of using lubricants, warm water can be used when taking cervical specimens. But for some patients, if lubricants are needed, it is advisable to use a small amount of water-soluble lubricants and also use lubricants that are free from carbamers. Lubricants should be applied in a thin layer to the outer blades of the speculum.
Last but not least, artifacts related to preparations. Appearance of these artifacts due to the delay in specimen preparation and fixation. There are some effects due to delay fixation. All of you can refer to the table that I provided on this video. As a result of delayed fixation, it can cause degenerative changes in cells. As I attached the picture, it indicated that the cytoplasm was changing, with small vacuoles and a patchy distribution of pap stains. Within a week, micronuclei appeared, along with growth of bacterial colonies, invading from periphery toward the center. Next, there was a delay in the appearance of nuclear signs of degeneration for more than a week. These included karyolysis, karyorhexis, and pycnosis. In the fourth week, ghost outlines of nucleus and cell appeared with loss of cellular features. However, delayed fixation at variable temperature also affects the cells. The explanation about these is already shown above. So, as a precaution, the specimen needs to be fixed as soon as possible in order to reduce any cellular changes that can affect the interpretation. The fixatives should also be filtered after each use. The rest of prevention can be referred to as above. Here are our references, and these are our team members. That's all from us. Thank you.